For decades, body mass index, or BMI, has served as the standard tool for evaluating health based on weight. It's simple, quick, and widely used in everything from insurance assessments to doctor visits and public health campaigns. But this simplicity comes at a cost. BMI is an outdated and often misleading metric that fails to capture the complexity of human health. Despite its ubiquity, it doesn't account for crucial factors like muscle mass, fat distribution, or actual metabolic function, leading to misclassification of individuals and often perpetuating stigma without improving outcomes. BMI was never designed to be a diagnostic tool. It was created in the 19th century as a population-level statistic, not a measure of individual health. Yet over time, it became a default shortcut. Plug in a person's height and weight, and you get a number that supposedly predicts their risk for chronic disease. But this number tells us nothing about body composition. A lean, muscular athlete might be classified as overweight or even obese, while someone with low muscle mass and high visceral fat could be labeled normal weight, despite elevated health risks. This mismatch is not theoretical. It plays out every day in clinical settings, where BMI-based assessments may miss serious issues or overpathologize healthy bodies. Beyond body composition, BMI doesn't reflect where fat is stored, arguably one of the most critical aspects of health. Visceral fat around the organs is far more dangerous than subcutaneous fat under the skin, yet two people with identical BMIs could have vastly different fat distributions and metabolic profiles. One might be insulin-sensitive with excellent cardiovascular markers, while the other struggles with inflammation and poor glucose regulation. But both would receive the same BMI-based label and possibly the same misguided advice. This reliance on BMI isn't just flawed, it can be harmful. It can lead to shame-based health messaging, discourage people from seeking care, and incentivize quick fixes aimed at lowering weight rather than improving health. For patients who are labeled as overweight or obese, the focus often shifts away from holistic health improvements toward weight loss as an end in itself, sometimes at the expense of mental health, eating patterns, and sustainable behavior change. Conversely, people in the normal BMI range may be falsely reassured and miss early signs of metabolic dysfunction simply because their weight appears acceptable. That's why many experts are calling for a more nuanced approach. Health professionals increasingly emphasize metrics like waist circumference, body fat percentage, blood pressure, lipid profiles, insulin sensitivity, and inflammatory markers. These indicators provide a clearer, more individualized picture of someone's health risk and potential. They allow for more precise, targeted interventions, ones that don't rely on weight alone as a proxy for well-being. This shift is especially important in an era where weight stigma and body dissatisfaction are widespread. Moving beyond BMI can support a more compassionate, evidence-based model of care, one that honors the diversity of healthy bodies and doesn't reduce a person's health to a single number. It opens the door to patient-centered strategies that focus on function, resilience, and prevention, rather than arbitrary weight categories. Still, completely abandoning BMI may not be practical in all settings. It remains a fast, low-cost tool that can provide a general starting point in some public health applications. But its role must be redefined and contextualized. Rather than treating it as a diagnosis, it should be one data point among many, always interpreted with a critical eye and supplemented with more meaningful health measures. The myth that BMI defines health is slowly unraveling, replaced by a more sophisticated understanding of how our bodies actually work. Real health is dynamic, multidimensional, and deeply personal. Recognizing that and adjusting how we measure and talk about it is essential to building a healthcare system that truly serves everyone.